Question 1. A patient with heart failure is started on an ACE inhibitor. Which adverse effect requires immediate attention? A. Dry cough. B. Swelling of the feet. C. Shortness of breath. D. Swelling of the lips and face. Answer: D. Swelling of the lips and face. Rationale: angioedema, indicated by swelling of the lips and face, is a life-threatening side effect of ACE inhibitors and requires immediate discontinuation and intervention. Question 2. A 60-year-old patient on furosemide for heart failure presents with muscle weakness. What should the nurse assess first? A. Potassium levels. B. Heart rate. C. Respiratory rate. D. Blood sugar levels. Answer: A. Potassium levels. Rationale: furosemide can cause hypokalemia, which leads to muscle weakness. The nurse should first check potassium levels, as low potassium is a common side effect. Question 3. A patient is prescribed amiodarone for atrial fibrillation. What should the nurse monitor closely during the first few weeks of therapy? A. Liver enzymes. B. ECG for arrhythmias. C. Renal function. D. Pulmonary function. Answer: D. Pulmonary function. Rationale: amiodarone can cause pulmonary toxicity, so close monitoring of pulmonary function is critical, especially in the first few weeks. Question 4. A patient on warfarin presents with a nosebleed that doesn't stop after 10 minutes of pressure. Which action should the nurse take next? A. Administer vitamin K. B. Apply ice to the nose. C. Administer a dose of aspirin. D. Notify the physician immediately. Answer: D. Notify the physician immediately. Rationale: a persistent nosebleed in a patient on warfarin may indicate excessive anticoagulation, requiring immediate medical attention. Vitamin K may be needed to reverse it. Question 5. A patient is started on a combination therapy of ACE inhibitors and potassium-sparing diuretics. Which symptom would indicate a potential dangerous side effect? A. Frequent urination. B. Nausea and vomiting. C. Muscle cramps and weakness. D. Hyperkalemia. Answer: D. Hyperkalemia. Rationale: the combination of ACE inhibitors and potassium-sparing diuretics can lead to hyperkalemia. Symptoms like muscle cramps and weakness are early signs of high potassium levels. Question 6. A diabetic patient taking corticosteroids for asthma reports increased thirst and frequent urination. What is the most likely cause? A. Hyperglycemia due to corticosteroid use. B. Dehydration from corticosteroid use. C. Electrolyte imbalance. D. Infection. Answer: A. Hyperglycemia due to corticosteroid use. Rationale: corticosteroids can increase blood glucose levels, leading to symptoms of hyperglycemia, such as increased thirst and urination, particularly in diabetic patients. Question 7. A patient receiving chemotherapy with methotrexate reports fatigue, mouth sores, and easy bruising. What should the nurse assess first? A. Hemoglobin and hematocrit levels. B. Platelet count and signs of bleeding. C. Liver function tests. D. Blood glucose levels. Answer: B. Platelet count and signs of bleeding. Rationale: methotrexate can cause bone marrow suppression, leading to thrombocytopenia and bleeding. Assessing platelet count and signs of bleeding is crucial. Question 8. A 45-year-old patient is prescribed metformin for type 2 diabetes. Which condition requires immediate cessation of the drug? A. Anemia. B. Dehydration. C. Lactic acidosis. D. Hypertension. Answer: C. Lactic acidosis. Rationale: metformin can cause lactic acidosis, a rare but life-threatening complication, especially in patients with renal or hepatic impairment. Immediate cessation is necessary. Question 9. A patient with asthma is prescribed a beta blocker for hypertension. What potential interaction should the nurse monitor for? A. Decreased blood pressure. B. Bronchospasm. C. Hyperglycemia. D. Dehydration. Answer: B. Bronchospasm. Rationale: beta blockers can cause bronchospasm in patients with asthma, so it is important to monitor respiratory status closely and consider alternative antihypertensives. Question 10. A post-operative patient who is on pain management with morphine develops pinpoint pupils and shallow breathing. What is the priority intervention? A. Increase the oxygen flow. B. Administer naloxone. C. Administer a sedative. D. Encourage deep breathing exercises. Answer: B. Administer naloxone. Rationale: morphine can cause respiratory depression, and naloxone is the antidote for opioid overdose. Immediate administration of naloxone is essential to reverse the effects. Question 11. A patient with lithium therapy for bipolar disorder reports a hand tremor, increased thirst, and decreased urine output. What is the priority nursing action? A. Administer additional lithium. B. Check lithium blood levels immediately. C. Increase fluid intake. D. Discontinue the medication. Answer: B. Check lithium blood levels immediately. Rationale: these symptoms indicate possible lithium toxicity, which requires immediate blood level monitoring to prevent further complications. Question 12. A patient with chronic kidney disease is prescribed an NSAID for pain. Which complication should the nurse monitor for? A. Hyperkalemia. B. Increased creatinine levels. C. Hypoglycemia. D. Hypertension. Answer: B. Increased creatinine levels. Rationale: NSAIDs can worsen renal function, leading to an increase in creatinine levels, especially in patients with pre-existing kidney disease. Monitoring kidney function is essential. Question 13. A patient is being treated for a hypertensive crisis with nitroprusside. What is the priority nursing intervention? A. Monitor for signs of cyanide toxicity. B. Administer oxygen as needed. C. Restrict fluid intake. D. Check renal function regularly. Answer: A. Monitor for signs of cyanide toxicity. Rationale: nitroprusside can break down into cyanide, especially with prolonged use, and cyanide toxicity can cause life-threatening symptoms, making it the priority concern. Question 14. A patient on theophylline for asthma reports experiencing palpitations and anxiety. Which action should the nurse take first? A. Administer a beta agonist. B. Assess the patient's theophylline levels. C. Encourage deep breathing exercises. D. Provide a sedative. Answer: B. Assess the patient's theophylline levels. Rationale: the symptoms of palpitations and anxiety may indicate theophylline toxicity, which requires immediate blood level monitoring to adjust the dosage. Question 15. A post-operative patient is on opioids and develops respiratory depression. What is the first priority for the nurse? A. Administer naloxone. B. Raise the patient's head of bed. C. Assess oxygen saturation levels. D. Increase the oxygen flow. Answer: A. Administer naloxone. Rationale: naloxone is the antidote for opioid-induced respiratory depression and should be administered immediately to reverse the effects and stabilize the patient. Question 16. A patient with atrial fibrillation is on digoxin. What assessment finding would be most concerning? A. Heart rate of 52 BPM. B. Blood pressure of 130 over 85 millimeters of mercury. C. Serum potassium level of 3.0 milliequivalent per liter. D. Respiratory rate of 18 breaths per minute. Answer: C. Serum potassium level of 3.0 milliequivalent per liter. Rationale: hypokalemia increases the risk of digoxin toxicity, which can result in life-threatening arrhythmias. A low potassium level should prompt immediate action. Question 17. A patient with rheumatoid arthritis is prescribed methotrexate. What is a potential serious side effect that requires monitoring? A. Liver toxicity. B. Weight loss. C. Insomnia. D. Hypoglycemia. Answer. A. Liver toxicity. Rationale. Methotrexate can cause liver damage, so monitoring liver function tests is necessary to detect early signs of toxicity. The other options are not common side effects. Question 18. A patient receiving chemotherapy for breast cancer develops severe nausea. What should the nurse anticipate as part of the treatment plan? A. Antiemetics, including ondansetron. B. Increased fluid intake. C. Administer a high-protein diet. D. Prescribe a stool softener. Answer. A. Antiemetics, including ondansetron. Rationale. Chemotherapy often causes severe nausea, and ondansetron is a common antiemetic used to prevent and manage this side effect. Question 19. A 70-year-old patient with hypertension and atrial fibrillation is prescribed amiodarone. What serious side effect should the nurse monitor for? A. Visual disturbances. B. Low blood pressure. C. Severe dry mouth. D. Frequent urination. Answer. A. Visual disturbances. Rationale. Amiodarone can cause optic neuropathy and visual disturbances, which should be closely monitored, particularly in older patients. Question 20. A patient with asthma is using a long-acting beta-agonist, LABA, inhaler. What should the nurse caution the patient about? A. LABA should be used for acute asthma attacks. B. LABA should be used alone without a steroid. C. LABA may cause paradoxical bronchospasm. D. LABA should be used only with an oral steroid. Answer. C. LABA may cause paradoxical bronchospasm. Rationale. LABAs can sometimes cause paradoxical bronchospasm, so the nurse should educate the patient to report any increase in wheezing or difficulty breathing immediately. Question 21. A patient is prescribed heparin for deep vein thrombosis and develops severe bruising and hematuria. What is the priority nursing intervention? A. Apply pressure to the bleeding site. B. Administer protamine sulfate. C. Discontinue heparin immediately. D. Monitor the patient's clotting factors. Answer. B. Administer protamine sulfate. Rationale. Protamine sulfate is the antidote for heparin overdose and should be administered immediately to reverse its anticoagulant effects and prevent further bleeding. Question 22. A patient on theophylline therapy for asthma reports increased heart rate, tremors, and nausea. What should the nurse do first? A. Increase the theophylline dose. B. Administer an antiemetic. C. Check theophylline blood levels. D. Administer a beta blocker. Answer. C. Check theophylline blood levels. Rationale. These symptoms are indicative of theophylline toxicity. The priority is to check the blood levels of theophylline, as it has a narrow therapeutic range. Question 23. A patient with hypertension and diabetes is started on an ACE inhibitor. Which side effect is the most concerning in this patient population? A. Persistent dry cough. B. Hyperkalemia. C. Angioedema. D. Orthostatic hypotension. Answer. B. Hyperkalemia. Rationale. ACE inhibitors can cause hyperkalemia, especially in patients with diabetes and kidney impairment. Monitoring potassium levels is crucial to prevent life-threatening complications. Question 24. A patient undergoing chemotherapy presents with a fever of 101 degrees Fahrenheit and an absolute neutrophil count, ANC, of 500. What should the nurse do first? A. Administer antipyretics. B. Apply a cooling blanket. C. Initiate broad-spectrum antibiotics. D. Contact the oncologist for a dose adjustment. Answer. C. Initiate broad-spectrum antibiotics. Rationale: neutropenic fever is a medical emergency in immunocompromised patients. Initiating broad-spectrum antibiotics promptly is critical to prevent sepsis. Question 25. A patient receiving digoxin for heart failure develops nausea, visual disturbances, and bradycardia. What should the nurse do next? A. Administer a dose of digoxin. B. Monitor potassium levels. C. Check serum digoxin levels. D. Increase the digoxin dosage. Answer: C. Check serum digoxin levels. Rationale: these are signs of digoxin toxicity. Checking serum digoxin levels is the next step to confirm the toxicity and adjust the dosage as needed. Question 26. A patient with chronic kidney disease is prescribed metformin for type 2 diabetes. What is the most serious risk associated with this combination? A. Hypoglycemia. B. Renal failure. C. Lactic acidosis. D. Hyperkalemia. Answer: C. Lactic acidosis. Rationale: metformin is contraindicated in patients with chronic kidney disease due to the risk of lactic acidosis, a potentially fatal complication. Question 27. A patient with schizophrenia is prescribed clozapine. Which side effect requires close monitoring and intervention? A. Hypertension. B. Agranulocytosis. C. Hypoglycemia. D. Weight loss. Answer: B. Agranulocytosis. Rationale: clozapine can cause agranulocytosis, a life-threatening reduction in white blood cell count, requiring regular blood monitoring to detect early signs of infection. Question 28. A patient receiving warfarin therapy has an INR of 5.0. What should the nurse do first? A. Administer vitamin K. B. Hold the next dose of warfarin. C. Increase the dose of warfarin. D. Check for signs of bleeding. Answer: A. Administer vitamin K. Rationale: an INR of 5.0 indicates that the blood is too thin, increasing the risk of bleeding. Vitamin K is administered to reverse the effects of warfarin and restore normal clotting. Question 29. A patient on NSAIDs for chronic pain management reports black, tarry stools. What is the priority action for the nurse? A. Administer a stool softener. B. Monitor vital signs for signs of shock. C. Stop the NSAID and notify the healthcare provider. D. Assess for abdominal pain. Answer: C. Stop the NSAID and notify the healthcare provider. Rationale: black tarry stools are a sign of gastrointestinal bleeding, a known side effect of NSAIDs. The medication should be stopped immediately, and the healthcare provider must be notified. Question 30. A 72-year-old patient with heart failure and renal impairment is prescribed a combination of ACE inhibitor and diuretic. What is the most important nursing action? A. Monitor potassium levels. B. Monitor blood pressure. C. Monitor for signs of dehydration. D. Monitor renal function. Answer: D. Monitor renal function. Rationale: in patients with renal impairment, ACE inhibitors and diuretics can worsen kidney function. Renal function should be closely monitored to prevent further deterioration. Question 31. A patient receiving vancomycin for an infection develops red man syndrome. What is the appropriate nursing intervention? A. Discontinue the vancomycin infusion. B. Administer an antihistamine. C. Decrease the infusion rate. D. Administer a corticosteroid. Answer: C. Decrease the infusion rate. Rationale: red man syndrome is a histamine reaction caused by rapid infusion of vancomycin. Slowing the infusion rate usually alleviates the symptoms. Question 32. A patient is prescribed nitroglycerin for angina. Which side effect requires the nurse to monitor the patient closely? A. Dizziness and hypotension. B. Nausea and vomiting. C. Headache and blurred vision. D. Tachycardia and sweating. Answer: A. Dizziness and hypotension. Rationale: Nitroglycerin can cause significant hypotension and dizziness due to its vasodilation effects. The nurse should monitor for these symptoms, especially after the first dose. Question 33. A patient with a history of depression and a new prescription for fluoxetine reports new onset insomnia and agitation. What should the nurse do? A. Increase the dose of fluoxetine. B. Administer a benzodiazepine for sedation. C. Reassess the patient's mental status. D. Notify the healthcare provider. Answer: D. Notify the healthcare provider. Rationale: Fluoxetine, a selective serotonin reuptake inhibitor (SSRI), can increase agitation and insomnia, especially in the early stages of treatment. The healthcare provider should be notified to reassess the therapy. Question 34. A patient is prescribed levothyroxine for hypothyroidism. Which symptom indicates that the dose may be too high? A. Weight loss. B. Bradycardia. C. Diarrhea. D. Tachycardia. Answer: D. Tachycardia. Rationale: An excessive dose of levothyroxine can cause symptoms of hyperthyroidism, such as tachycardia, anxiety, and weight loss. These should be monitored and addressed promptly. Question 35. A patient taking warfarin for atrial fibrillation is scheduled for a dental procedure. What is the nurse's priority action? A. Ensure the INR is within therapeutic range. B. Administer a dose of vitamin K. C. Hold the warfarin dose for the procedure. D. Advise the patient to stop warfarin 1 week before. Answer: A. Ensure the INR is within therapeutic range. Rationale: Before any procedure, it is crucial to ensure the INR is within the therapeutic range to reduce the risk of bleeding. Adjustments in warfarin dosage should be based on this assessment. Question 36. A patient with severe osteoporosis is prescribed alendronate. Which instruction is most important for the nurse to include in patient education? A. Take the medication with a full glass of water. B. Take the medication with food. C. Take the medication before bed. D. Take the medication with a calcium supplement. Answer: A. Take the medication with a full glass of water. Rationale: Alendronate must be taken with a full glass of water, and the patient must remain upright for at least 30 minutes to prevent esophageal irritation. Question 37. A patient with asthma is prescribed a combination inhaler with a corticosteroid and a long-acting beta agonist. What is the priority teaching point? A. Use the inhaler during an asthma attack. B. Rinse the mouth after use. C. Use the inhaler once per day. D. Avoid drinking fluids immediately after use. Answer: B. Rinse the mouth after use. Rationale: Rinsing the mouth after using a corticosteroid inhaler helps prevent oral candidiasis, a common side effect. It also reduces the risk of hoarseness. Question 38. A patient receiving erythropoietin for anemia reports a sudden headache, nausea, and hypertension. What is the most likely cause? A. Iron deficiency. B. Rapid increase in hemoglobin levels. C. Infection. D. Medication allergy. Answer: B. Rapid increase in hemoglobin levels. Rationale: Erythropoietin stimulates red blood cell production. A rapid increase in hemoglobin can lead to hypertension and other symptoms like headache and nausea. Question 39. A patient with a history of heart failure is started on a diuretic. Which electrolyte imbalance should the nurse monitor closely? A. Sodium. B. Calcium. C. Potassium. D. Magnesium. Answer: C. Potassium. Rationale: Diuretics, particularly loop diuretics, can lead to hypokalemia, which can cause dangerous arrhythmias. Potassium levels should be closely monitored. Question 40. A patient taking methotrexate for rheumatoid arthritis reports persistent sore throat and fever. What should the nurse do first? A. Administer an analgesic for pain relief. B. Assess for signs of infection and check WBC. C. Advise the patient to take vitamin C. D. Hold the next dose of methotrexate. Answer: B. Assess for signs of infection and check WBC. Rationale: methotrexate can cause immunosuppression, leading to an increased risk of infections. The nurse should assess for signs of infection and check the patient's white blood cell count. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!